Hello, everyone. Thank you so much for hopping in. It's another day. My name is Brian Simonyema. I'm a medical student studying radiography in my third year, based in Nigeria. And apart from my medical studies, I'm also a proficient freelance medical content writer. So today is an amazing Mac talk with a student before and now gonna be a doctor in a few months. So hey, Maya, could you introduce yourself?
Hi, everyone. My name is Maya O'Neill, and I am a fourth year medical student that just matched in pediatrics, and I'll be graduating in about 3 months now as a osteopathic physician. And I'm just excited to start this journey and to have this talk with you.
Absolutely. So we have a few more questions for you to answer for the audience. Are you ready?
Yes.
So the first question goes this way. So if I'm looking downwards, I'm reading the questions to Maya to answer for the audience. So you'll be wondering what am I looking downwards for? So it's just like a disclaimer out there. So the first question goes this way. What made you choose pediatrics as your specialty? Why didn't you choose other professions in medicine? Why pediatrics? Tell me.
Well, actually, my idea of pediatrics first started when I was younger. My best friend has a chronic disease. And so growing up, I would often visit her in a children's hospital. And I remember going into the hospital and just thinking, like, this place is so colorful and it just didn't seem as cold and as dark as I had presumed hospitals to be. And then also, I fell in love with the idea of being someone's primary care physician versus doing something like surgery, like, ENT. I wanted that one on one, like, relationship with my patient. I wanted to be able to build trust over several years with patients and their families. And so I also loved working with children. So pediatrics just kind of fit that whole realm of exactly what I wanted. And I'm originally from Georgia, which has such a shortage in pediatricians. And so I wanted to kind of fill that void as much as I could.
When you mention Georgia, do you mean one of the states in the US or like a country itself?
I'm from Georgia, USA, Georgia.
Oh, okay. Yeah, because you have Georgia as a country itself. I'm just trying to
Yes.
like to make it more specific. So I understood that your journey and your passion into pediatrics started from childhood, which is an amazing stuff. And today you've achieved that goal. How do your parents feel when you do that?
My parents are so proud of me. My mom has told me how I've always said I wanted to be a pediatrician, I wanted to work with kids, even from a young age. So the moment when I got that email that I matched and I knew for sure it was pediatrics, it was just such an amazing moment, like something that I can't even put into words. It's just looking back for, decades of me saying that I wanted to achieve this goal and to finally go past that line is amazing. And my mom just tells me all the time how proud she is of me. And, my cousins say the same thing, that I'm kind of, an inspiration to other people that look like me and other family members that, it's, you can achieve it. If I can do it, then anybody can do it.
Wow, wow. Are you the first person to do a medical related course in your family?
Well, my mom is actually a nurse, but growing up, she was not a nurse. She went back to school after, when I was in high school. She was a stay-at-home mom, and then I'm the first person that's a physician in my whole family.
Wow. That's a big achievement, Maya. Thank you so much for sharing that. So that draws me to the second question. But before I ask you the second question, there are people they're gonna watch this video and they'll be like, "Hey, I want to study pediatrician or whatever pediatrics, sorry, as a course." So tell us, how was the application process was like when you were applying to go into med school to study pediatrics, and what university did you graduate from?
Okay, so here in the United States, you have to do a 4-year course of undergraduate education or university. And so I went to the University of Alabama at Birmingham, where I studied chemistry and I minored in public health. So that was 4 years. And then after that, I decided to take a year off and to work and save up some money. And I was a patient care tech. So that's where I got kind of one-on-one training with working with patients, speaking to medical professionals. And then I started medical school in 2020 in the pandemic. So I applied to medical school in 2019. And here in the US, you need like letters of recommendation. You have to have a good GPA. I took the MCAT once and I did, relatively okay, not the best, but good enough, to get in. And then I applied. I guess I can give my complete stats just to be transparent. I did not think I was going to get into medical school. So the first round, I thought I was going to have to reapply. So I only applied to 4 medical schools, and which is like most people apply to a lot more than that. Um, and 2 of the medical schools I got in. I got interviews and I got in. And I think it was more my research because I had done a lot of research in undergrad. I did both bench research, like in a chemical lab, since I have a chemistry degree. And also, I did clinical research abroad in Jamaica, and which I published that. And so I had a lot of research. I had a year's worth of working experience in the healthcare environment, and I had amazing stellar grades. I think I had I think I graduated with 3.9 or 3.8. And then after getting into medical school, I did 4 years of that, and I go to VCOM, which is Edward Via College of Osteopathic Medicine, which is a DO school. And I am about to graduate in May of this year. And last year is when you start the application process, determining what specialty that you want to go into. And throughout medical school, you take 2 board exams here in the US, and what you make on those exams determines the type of doctor that you can be. So you may go in thinking that you want to do dermatology, but that's very competitive. And if you don't get the right score, then you're not going to be able to become that type of physician. Pediatrics is in great need and is not as popular amongst medical students because it is a primary care specialty, and because unfortunately pediatrics does not make as much money, and medical school here in the US is so expensive. If you're coming out with 6 figures worth of debt, then like that's something that's going to be in your mind, unfortunately. And so going into pediatrics, it wasn't as competitive. So I applied to that same process, got my letters of recommendation. I had published my paper by then, so I put that on there. And then I had done a lot of volunteering. So I had that as well to kind of go into that process and do my interviews. And then you apply, you match, and that's how you know what type of doctor you're going to be.
Wow, that was an amazing illustration you did right there. Thank you so much for sharing that with us. So I'm kind of like curious. You did a major in public health, right?
Yes. Mm-hmm.
So what did you do with that knowledge you gained from public health? How does it tally with your studies in pediatrics? How does it collaborate with each other?
Well, that's actually a great question because, especially as a primary care physician, a lot of the problems that our patients come in with is systemic issues that are just here in the US that are part of the US healthcare system. Like, for example, if someone comes in with asthma, especially a child, which is very popular pediatric problem, a lot of times that can be attributed to their environment, what they grew up with, the types of environmental exposures, the year that the house was built, are they near farmland, and just if they're exposed to many minerals or things that are toxins that are in the air, if they're near injury. And public health looks at more the broadness of like social determinants of health, of things that we maybe cannot change on a person to person level, but we can change on a broader scale. So it teaches you to think of the bigger picture. Like, if someone comes in with this issue, what are the reasons why? And what are maybe some environmental things that they can do to change, kind of, like for my asthma example, maybe get a humidifier, maybe get an air purifier, things that we don't particularly think of when it comes to a physician standpoint, where we're just thinking, okay, what's the treatment? How do we diagnose? Here's the medication, but kind of taking a broader aspect to the reasons why some of our patients have the issues that they do.
Wow. I'm a bit speechless right now. I think I'm going to come back to that question because I have a lot of questions for you right now. But that draws me back to the second question. So, how did your med school influence your decision? Tell us.
Well, I went into medical school knowing that I wanted to be a pediatrician, and a lot of people change once they get into medical school and they actually rotate in that specialty and understand kind of the behind the scenes of what that would entail and the lifestyle that would want. But I stayed firm on that, and just in medical school, rotating through general surgery, OBGYN, it just made it more and more apparent to me, number one, the lifestyle that I wanted to live. I did not want to have medicine consume my entire life, because I am an individual and I am a person first. I want to have a family. I want to have other aspects, like maybe a YouTube channel or other aspects to approach patients and things like that. And so seeing how hard other professions, like their hours wise, I was like, oh, also seeing primary care and how a lot of times those patients, they really rely on their primary care doctors and they have that one-on-one relationship. I knew I wanted that. So my medical school just kind of made it more prominent that I want to be a pediatrician and this is what I want to do.
Hmm, that was an amazing answer right there, Maya. I'm really impressed, and I believe that the audience greatly appreciate this. Thank you so much for sharing that. But that draws me back to the question I want to ask you about public health and pediatrics. You know, so tell me, you said, yeah, they correlate together, in terms of patient care, attendant or something. So tell us, because I've had a public health specialist, graduated from University of, I think, Maryland or something. I can't remember the school, but she graduated from there. Did an undergraduate in public health, did a master's in also public health, and now she's a writer. She writes about things related to wellness, sexual health, and stuff like that. So I want to know something. My little understanding as a med student, I'm studying radiography, but I'm really versatile in other specialties, right? So in my little understanding about public health talks about community health. There are two different courses, but they also correlate. Like, you have radiology, you have radiographers, but community health and public health, they do the same things, but in a different varieties. So tell me, Pediatrics is all about kids, dealing with children's health and everything. So, do you intend in the future to, do an outreach? You're gonna like maybe like you did a research in Jamaica. You went travel to Jamaica to do a research. So, are you gonna do something like that in related to you being a pediatrician, like you traveling or going for an outreach to meeting other children that are in bad health or in different kind of diseases and stuff like that? Are you gonna do that in the future?
Yes, that is my ultimate goal. When I did get, and I got a minor in public health, so I didn't get my degree in public health, but I did take a lot of the courses enough to get a minor. But that was one thing that drew me to that field was the global health aspect of public health and kind of studying how healthcare is in other countries and how that impacts their population and kind of how we can help and also how we can take those ideas and bring them back here to the US. And so I've been to Honduras. That was before I started medical school. And then I did my research in Jamaica. And in medical school, I was actually able to rotate in the Dominican Republic in one of their child health centers. And so that is something that I'm very passionate about. And actually, in right after graduation, I am going to Zambia and to rotate there as well, with a community health center there, because I think we can learn so much more about healthcare in other countries, and in certain countries and other countries they have certain things they do really well in their health system, that we could take back here to the US. Also, we have some things here in the US. We have more access to certain things that I would love to bring over there and to impact how their healthcare is as well. So I think healthcare is a great way that we can just keep the communication open between countries and that we can all work together to create a more healthy population throughout the entire world, and just a better way of living. And healthcare is a great way for us to be able to do that.
Wow, that's amazing that you are going to do such a thing. You've already started it, and you're yet to do more. On your playlist. Is the only Zambia you're trying to go? What about Nigeria, my country? Are you gonna come to Nigeria?
I would love to come to Nigeria. Honestly, I would love to come to all of Africa. I want to see different countries in Africa, different environments. I would love to go to Morocco. One of my best friends is actually going to Ghana later this year. And because I'm starting residency, I'm not able to go with her. And I also plan on going to South Africa after Zambia, since it's just like a quick direct flight. And possibly Kenya and Botswana. And I would just love to visit all parts of the world, but definitely the motherland of Africa. That's been like a bucket list destination for me. So I'm very excited to come.
Yeah, absolutely. And that we'll really appreciate you coming, honestly. Yeah. So that draws me to the third question. You ready? Can you provide some information about the process in comparison, you know, and also share your advice for medical students planning to apply? I think you've answered that question before, right? But what are your advice for people hoping to apply for med school or like looking forward to doing the course you did in pediatrics? So what are your advice for them?
Okay, so my top advice would be to keep going and don't let no one else tell you, don't let don't let yourself stop yourself, because a lot of times we get to difficult places and we're like, this is too hard, like it's not meant to be, I quit. And so my advice is to keep going, keep pushing, don't tell yourself no, like because that happened to me in medical school. It was very difficult in the beginning, and I got to the breaking point where I was like, you know, this ain't it. But a lot of times at the other side of that breaking point is when your breakthrough is coming through. So my advice is to keep going. My other advice is to use your connections, because everyone else uses connections to kind of get ahead in here in the US. And so you never know what networking will bring to you. During my time off, just for an example, I worked in a just like a regular hospital on the south side of Atlanta. And one of the physicians there, I found out, was she had graduated from the school that I had applied to. And so I just sat there, I talked to her, and she ended up writing me a letter of recommendation on top of my application that I had already submitted like months before, and specially submitted it for me. And maybe like a few weeks later, I got an interview. So you never know like what anything may lead to. So to network, network, network. And just to be patient, just keep going. Like this is a very long journey. This is like at least 8 years, but a lot of people it's 9, 10, 12, 11, keep, multiple years. So just to keep going and just continue to have a positive mindset, and you will definitely get there.
That was an amazing nugget, and I believe that they will learn something from it. Thank you so much for sharing that with us. So, what are the problems do you think, or do you hope that you will encounter, during your time as a medical doctor with a specialization in pediatrics? So, tell me.
I think in the pediatrics, kind of the biggest, newest type issue that we're encountering is um, I would have to say either the misinformation that is out there when it comes to the field of pediatrics, and just healthcare in general. Social media is an amazing place where you can find all of these, answers to different problems. But there are also some people out there that are putting forth misinformation, whether it's to sell some type of program or some type of, drug or whatever, and it's having a negative impact on our patients and their healthcare. And and just the here in the US, like there have been a lot of mistrust when it comes to physicians, and which is, it's noted. Unfortunately, there are a lot of instances in the history of healthcare in the US, like with the Tuskegee experiment, that have created a lot of just barriers when it comes to people trusting physicians, people trusting their primary care physician. And it's just really sad to see, that just have an impact on children and on their families and their access to care. And also, like I stated before, here in Georgia, where I'm from, the access to healthcare is very, very slim. Like, just for example, because I looked up this number earlier, um, in 2020, there was a study done that said that there are 65 counties here in Georgia that have no pediatrician at all. And so, if you have a family or a child that's rural, they may not have a car to be able to drive to the next county, to get care. They may not have a car to drive to a pharmacy in order to obtain medication, or even barriers when it comes to healthy food and clean water. And so all of that can have an impact on the healthcare of a child. And when they're a child is when we need to set forth those we need to, as a child, like make sure that they have their health care on lock before they become an adult, and make sure we can catch things, we can, educate, we can teach, we can intercept the way that they can grow up. Like we need to intercept it early on, if that makes sense. I may be talking in circles, but it's just the access to care here in the US is still sad. In order for us, because we're a first world country, it's really sad care here. The amount of people that have no access, that have no insurance.
So how do you plan to overcome this problem?
Ooh, I mean, there are a lot of things that I've maybe thought about. I have ideas, but I'm not sure. I know that like pediatric urgent cares are becoming a lot more popular, kind of springing up. So I don't know if that's something. And then also, some healthcare systems have mobile healthcare, like they have a mobile van. And so I've also thought about that, and maybe driving to more rural areas a few times a month. I'm not really sure what the answer is. I think it's going to take multiple minds together in order to really come up with something sustainable that will have a positive impact on those populations there.
Amazing, amazing. So we have a few more questions to go, Maya. So I want to ask, before I ask the sixth question, there's something I want to tell you. Um, in my little research about child care or whatever it's called, um, I noticed that there are diseases that children these days face and encounter, which are very dangerous diseases. Some are curable, some are not really that curable. And so tell me, what do you believe is the most pressing issues in child care today, in your own perspective?
Wow, that is a great question. Um, Now, I haven't started my pediatrics training yet,
Yeah,
so
that's why I say to you, that's your own narrative. Sorry, I'm very creative in researching, and so the questions are really very tough, toxic, toughy in some places, So just try your best.
okay. I'm trying to think. Just mm, based off of
Take your
what I've
time.
seen,
Take your
I
time
would
and think. Take your time.
say that I would say, just off of my experience from my limited rotations that I have done so far, um, something that's kind of springing up is the mental health of children, and the fact that um, like I have seen, even in my psychiatry rotations, in my just other rotations, how, and just hearing about children that have, unfortunately, taken their own lives, or seeing patients that have, cut their arms, seeing patients that are so depressed that it impacts their other aspects of healthcare. So they're so depressed to the point where they don't go out, um, they either don't eat, and so they're anorexic, or they overeat, and now they're facing, childhood diabetes, they're facing obesity, high cholesterol as a child. And most of the times, those, like when I have seen it, it's all boiled down to the mental state of children now in this country, and especially after COVID, and the fact that, the idea of playing, like being with other people their age, it's not as often as it used to be. So I think that's a new epidemic that pediatricians are now learning how to face and learning how to, prescribe like antidepressants for a child, and as a pediatrician, you have to learn how to treat all their aspects of care as much as you can to the best of your ability before you transfer them out to a specialist like a psychiatrist. And so I remember that. I remember them, thinking, okay, how do I dose this medication for, a 6-year-old? Because that's something that up to this point, it wasn't as prevalent to have a 6-year-old that was, clinically depressed, or, a 12-year-old that it needs to be put on suicide watch. So it's really sad, and it's becoming more and more prevalent. It's something that we need to get ahead on before, it has such a more negative impact on children of our society.
Now, this question is a bit toxic and toffee. I didn't say toffee, toxic. Is it toxic or toffee or toffee toxic? What does? Correct me, please. Could you correct me? Is it toxic
I
toffee?
don't know what you're saying. I know toxic, but I don't know the other word.
Is it toxic
Um,
toffee? Like something's like not balanced or something. Do you understand?
no,
Uh,
no, I don't know that saying. I'm sorry.
it's fine. It's fine. So, this question: how do you plan to solve these problems you mentioned in your practice in the future? Now, before you answer that question, I want you to take your time, think about the answers, and before you answer that question, do well to answer this one I want to ask you right now. And this is: do pediatricians treat infants like 0 to 6 months of babies and something like that?
Yes, yes, they do. They treat
Okay.
from 0 to some places it's 21 years old. So
Wow. 21 years. It's not a baby. It's not a child.
it some offices do. Most stop at 18, but if they have like chronic diseases, then they will go up to 21. Even some places 25. So
Oh. So tell us, how do you plan to solve these problems in the nearest future during your practice?
well, let's see. Let me think first. I would say the first way to solve it is to have an aware that that could be an issue. And kind of going back to what I said about public health and the idea of thinking more broad and thinking more, why is this patient suffering like this? Like, why is this patient all of a sudden, gaining 50, 60, 70 pounds? Why are they all of a sudden sleeping 18 hours a day? Could it be a thyroid issue, or could it be that they're clinically depressed? So I think the first thing is to be aware that that could be an issue when it comes to our patients, our pediatric patients. And I know that this next wave of physicians, physicians that are, my age, my generation, we are more comfortable and more likely to talk about, depression and emotions and all of these things that maybe were more taboo when it comes to older generations that were before us. And so I think allowing us to have that conversation, and if the parent would allowing them to step outside the room and really truly getting that one-on-one conversation with our patients in order for them to feel that they have that safe space, that they're able to open up with to us, without repercussions when it comes to anything, that when it comes to depression, when it comes to, their sexual health and any other topics that may be taboo that they don't want to discuss with their parent or their guardian in the room. but just allowing that space, being aware that that can be a possibility and the reason that they're presenting in this type of format when it comes to their healthcare, and then learning how to counteract that and staying educated on, you know, what we should do and what medication should we prescribe, what um, what blood tests should we run, and when should we defer to a specialist, and so on.
Wow. Wow, that was an amazing, amazing narrative. Thank you so much. We have the last question to ask you, and you've been an amazing guest speaker, Maya. And I really, really adore your narratives and these questions, and I believe that the audience really, really will accept and learn from these answers you listed. So the last question goes this way. Before you answer that question, you're gonna tell, a little bit about pet tradition, like being a pet tradition. What does it mean to be a pet tradition? Maybe, right? Yeah. So before you
A
answer that question, you're gonna ask
pediatrician,
me,
is that
pet tradition.
is
Yeah,
that okay?
I bet. So you're gonna tell us what it means to be like that, and then the question goes this way: can you tell us about a memorable patient or case study that greatly influenced your perspective on pediatric medicine in general? To tell us.
Well, the biggest thing that pediatricians do is, I would have to say, educate. And what we do is, when patients come in, a lot of times they're completely healthy, you know, but we are there to educate, we are there to inform, we are there to promote the wellness of our patients, which is something that drew me to this field versus something like internal medicine, because a lot of times those patients are already super sick and you're just kind of trying to navigate that, trying to come up with solutions, versus pediatrics. We see patients and we are trying to promote wellness. We are educating about their education, educating about food, educating about growth and development and milestones, and just trying to promote wellness at a young age that will hopefully have an impact on those patients when they become adults. And our goal is to help them on that journey and to ensure that they become happy and healthy adults, before they reach older age, and to instill in them those qualities that we want, and also to catch, like you mentioned earlier, those genetic diseases, those diseases maybe that can be preventable, that can be treated very early on, that won't have an impact on them as an adult. And so I learned that during my medical rotations, and, seeing them on their well child visits, seeing them at 2 months, 4 months, 6 months, it can be repetitive. And, for some parents and families, they're like, why do I have to bring them? But it's more about instilling wellness, and questions, having that open communication on healthcare, surrounding that individual, surrounding that patient, and and hopefully having a positive influence on them, so that when they are older and they do need help, they can kind of remember some of the things they taught. They can kind of feel that they can go to, their family medicine physician or their internal medicine physician. So that's kind of the goal of pediatrics. There are many. I'm trying to think of like a specific case that I can remember, um, that pertains to pediatrics. Only one is like really popping up to my head right now, and that was when I was that was during a pediatric rotation. And I remember I had a patient that had an open wound on their leg, and they were like upper teens. So they were about to actually age out of the system because they were, getting close in age to the cutoff age. And just looking at the leg, it didn't look that bad. Like, it did not look as infected as maybe you would think. But after doing all the scans and everything, the patient had osteomyelitis, and they had a botched surgery in another country. And basically what had happened, and with the translator, we were able to get their story, is that the patient had crossed the border and had walked through like one of the rivers and got some weird infection, and it had like infected their leg, and they were walking miles and hundreds of miles with an infected leg. And I just couldn't imagine how painful that had been, and couldn't imagine just the determination of a child, y'all, I'm talking a child, to go through that and to cross, through this tumultuous time when it comes to, politics, when it comes to, people's prejudices against people of a different culture. And just to hear them do that just so that they can get the health care that they so avidly needed, it was just a heart-wrenching story. And another thing I like about pediatrics versus adult medicine is that pediatric specialties work more closely together because we're dealing with kids. We're not dealing with older individuals. We're dealing with people that cannot really defend themselves, that cannot as well advocate for themselves. And so I like that we work with specialties. We have more exposure to social aspects of medicine. So we were able to get that patient hooked up with like medication for like 6 months, like antibiotics, medication, just to ensure that they were going to be okay when they left that facility. We were able to hook them up with like places to reach out to, like a number, a social worker. We were able to have like schedule their appointments when it comes to the other specialties that were involved, when it comes to a primary care. And, everybody was working together as a team to ensure the best healthcare for that patient. And that is so common when it comes to pediatrics. And I've had friends that have chronic diseases that when they aged out of the system, it was kind of like they were just left on their own. And that's a sad reality for a lot of adults that have chronic diseases and just adults in general. So that's one thing that I do love about pediatrics. And that's a story that really had an impact on me. Just hearing their determination as a child, as a child, I was thinking about their age. I was thinking about prom. I was thinking about going to the movies, going skating, not what am I going to eat next? Is my leg about to fall off? Like, am I even going to survive? That's not what I was thinking about. And, for some people in other countries and even here in America, that is the reality of what's going through children's head. And it's really sad.
To be honest, I'm really speechless right now. I don't know what to say. Honestly, I'm speechless. I don't know words to use to explain this memorable story you just shared to us that influenced you about the perspective of pediatrics and medicine in general. So thank you so much for telling us that. So we've come to the end of the session, and you've been an amazing guest speaker, Maya. So before we round up the session, could you just share your last words for the audience?
I just want to say thank you, Ransom, for having me on. And I really appreciate it. I like talking about these things, and it was fun. I'm glad that you invited me. And just for the audience, I would just say to, if you're interested in medicine, to just keep going, keep pushing, let them be the ones to tell you no. Don't tell yourself no. If they tell you no, find another avenue and you will be able to accomplish anything. And just for everyone out there, please, y'all, get your routine health screenings. If you're of age, this doesn't really pertain to pediatrics, but get your pap smear, get your colonoscopy, just make sure that you are checking in with your primary care physician and these avenues that can help to prevent, you know, cancers and things that can happen that are terrible that we don't want to happen, which is why we try to catch them early. So that's just a random thing, but please make sure that you guys are on top of that.
Perfect, perfect. But I want to summarize something you just said. Wait, when Maya was talking about keep going, I know it's not that easy. I'm still in med school, so it's not that easy. But that's the only way forward. Giving up shouldn't be on your playlist because it's not my playlist. It shouldn't be on your playlist. So make sure you're moving, and don't stop. you know, like Maya talked about that she really faced a lot when she was in med school. But look at her right now. Very soon she's gonna be a doctor. And she's really proud of herself, looking backwards about the challenges she faced. Assuming she stopped, assuming she failed. She failed sometimes, right? But she never stopped. But assuming
Yes,
she still stopped, she
definitely
wouldn't be a doctor. Yeah, she wouldn't have been a doctor right now. So learn from this, right? So thank you so much, Maya, for helping me, and we wish you well in your residency in a few months and your graduation. So thank you so much. So come to the end of the session. Do well to subscribe, like, and comment, and share to your network as well. Thank you. You're welcome, Maya.
Thank you guys.